Today we're going to be talking about the treatment options for renal failure, and that's when your kidneys fail. So as you know, the kidneys are an important organ and they help filtering toxins and also water from your blood. So when the kidneys stop working, you develop two problems basically. One, you accumulate fluid, so you have swelling and eventually you become short of breath because your lungs are full of fluid. So you need to get the fluid removed. The other problem is you accumulate these toxins and they will affect the way you feel. You start feeling bad, feeling nauseated. Your brain's not going to work as well. So that's why you need some form of treatment. Today, there are 3 treatments for renal failure. The most common and well-known one is called hemodialysis. Hemo means blood, and dialysis means filtering the blood. And to do that, what you have to do is you have to remove your blood, run through a machine, and put the blood back in your circulation. In general, to do hemodialysis, you go to a dialysis center where people can access whatever device you have for doing that and can do the whole procedure in there. Most of the time, people go to the dialysis center 3 times a week and they sit there for 3.5 to 4 hours at a time. Nowadays, some patients can do that at home. They can have a home dialysis machine, and there are incentives from the government to do that, so can make your life easier. Although, as we're going to talk about more in detail, it is kind of complicated to using the devices that are used for hemodialysis, and it's not for everyone. So not everybody can actually do that at home. Now, for patients that don't want to deal with blood or are scared to having hemodialysis or don't want to go to a center but don't want to do this at home, the other option is actually called peritoneal dialysis. Peritoneal dialysis is when we insert a tube in your abdomen into that peritoneal sac, which is the sac around your intestines. And what people found out that you can do is you can actually infuse some fluids in the peritoneal cavity, and that will remove the toxins and the fluid from your blood. I think there are several advantages of peritoneal dialysis. It is the most common type of dialysis that is done at home. Overall, less risk of infection and less risk of venous problems. But it is somewhat complicated to do, and it's also not for everybody. Also, peritoneal dialysis may be difficult in patients that had multiple prior surgeries into the abdomen, and the peritoneal dialysis only works for about 7 years. Now, it turns out that's not a problem because within 7 years, usually patients become candidates for transplant. And that brings us for the best option to treat renal failure for most patients, which is a kidney transplant. That's a surgery where they implant a kidney into your body to replace your normal kidneys. Usually they actually leave your kidneys in place and just implant a new kidney in the lower abdomen. In summary, those are the ways that you can treat renal failure and keep you alive. And we're going to be talking in a lot more detail about the devices that are used for access during both hemodialysis and peritoneal dialysis. I hope the content helps, and this is Minimally Invasive Insights, and I'll see you next time.